Hello, I'm Dr. O'Rourke with Fountain Direct Primary Care, and today I'm going to talk to you about COVID-19. So what is a virus? A virus is a lipid and protein capsule containing RNA, a single strand of genetic material. A virus attaches to a cell, the RNA enters that cell, and the information on the RNA is like a computer program, which reprograms the cell to make many copies of the virus until the cell explodes, releasing the virus. A viral capsule is mostly lipid with proteins on the surface. Soaps break down lipids or fats, so washing your hands with soap will destroy any viruses on your skin. The proteins on the viral capsule identify the virus. The immune system makes antibodies against these proteins. Many vaccines are made from viral proteins. They induce the immune system to make antibodies. If you are immune to a virus, your immune system can identify and destroy it using antibodies. Viral mutations are like typos which occur during RNA replication, which results in multiple strains of the same virus. Different strains of a virus may be more or less contagious or more or less deadly. Viral strains which cause mild symptoms are more likely to spread because people don't know they're infected and continue to work and socialize. Different strains may have different identifying proteins on their capsules, so antibodies to one strain may not work against another strain. Multiple strains of a virus make testing less accurate and vaccines less effective. This is why rapid flu tests are inaccurate and why you can still get the flu after getting a flu shot. There are already multiple strains of the 2019 novel coronavirus. There are 4 coronaviruses which cause 25% of colds. One study showed that 15% of completely healthy, symptom-free individuals are infected with one of these coronaviruses at any given time. If you do develop symptoms, you are the most contagious before your symptoms begin. Coronaviruses are spread mainly through droplets. This could occur if an infected person coughed or sneezed directly into your face. But more commonly, you get virus on your hands from shaking hands with an infected person or from a door handle or other shared surface, and then you touch your eyes, nose, or mouth. The virus can live on surfaces for up to 72 hours. Coronaviruses can be aerosolized through use of a nebulizer or ventilator, but typically outside of the hospital, they are not airborne like influenza viruses, which can be spread by breathing the same air as an infected individual. You may have heard of 2 other coronaviruses. SARS in 2002 had a 10% fatality rate and is an 80% genetic match to the 2019 novel coronavirus. MERS in 2012 had a 35% fatality rate. The novel coronavirus has all the features of a pandemic virus. It is different enough from other coronaviruses that we have no partial immunity from previous coronavirus infection. It is more contagious than the 4 common coronaviruses. The majority who become infected have no symptoms. The incubation period is a symptom-free period when you are still contagious, and it lasts for 1 week. After 10 days of symptoms, some people develop severe complications requiring hospitalization. Fatality rate cannot be calculated until after a pandemic because you need the total number of cases and the total number of deaths. But the current estimate is 3.4%. Because so many are asymptomatic, we are probably underestimating the number of infected and overestimating the fatality rate. We can prevent infection by avoiding the virus through social distancing, cleaning shared surfaces, and hand washing. Masks help the infected to avoid spreading the virus, but do not protect the wearer. Don't wear gloves. They increase viral spread because the virus can live on gloves for 72 hours. We can prevent infection by stopping the virus. Hydroxychloroquine and chloroquine are antimalarial drugs which prevent the malaria parasite from entering red blood cells. They may also prevent novel coronavirus from entering our cells, but they can cause severe side effects. They also have anti-inflammatory properties and lower levels of IL-6, which we will come back to. This is why hydroxychloroquine is used for treating autoimmune inflammatory diseases like lupus and rheumatoid arthritis. Zinc prevents viral replication, stopping an infection before it begins. I recommend taking zinc 10 milligrams daily. Various antiviral medications are being studied, which prevent viral entry and replication. Scientists are also working on creating a vaccine. The virus which causes COVID-19 can produce severe inflammation called a cytokine storm, starting with pro-inflammatory cytokine IL-6, which then sets off a chain reaction starting with PAI-1, which results in thrombosis or tiny blood clots, which can damage all of the organs in the body. This process is known as DIC, disseminated intravascular coagulation. Inflammation in the lungs causes damage at a cellular level by destroying surfactant, which is like a soap inside the alveoli or individual air cells in the lungs. Surfactant keeps the lung cells slippery, preventing them from collapsing when you exhale. In COVID-19, when enough alveoli have collapsed, patients develop acute respiratory distress syndrome requiring ventilator support. Remember hydroxychloroquine and chloroquine? They both lower IL-6, but they can cause severe side effects. Studies of these medications in patients with COVID-19 have produced mixed results, with some demonstrating improvement and others showing increased risks of death. There are safer ways to lower IL-6. Both antihistamines and vitamin D lower IL-6. I recommend Claritin 10 milligrams daily and vitamin D3 5,000 units daily. Azithromycin is an antibiotic which has decongestant properties and is used in treating other lung conditions such as COPD exacerbation. It has been tried in COVID-19 patients with questionable benefits. As we age, we become more prone to thrombosis or blood clots, which is why heart attacks and strokes are more common among the elderly. Men are more prone to thrombosis than women. Certain medical conditions put you at higher risk of thrombosis, including high blood pressure, high cholesterol, and diabetes. Smoking and eating processed foods increases the risk of thrombosis as well. These are the reasons why COVID-19 poses a higher risk for the elderly, for men, and for those with certain chronic medical conditions. Dengue fever is caused by a virus which increases PAI-1. It's possible that COVID-19 does the same. If you have high blood pressure, high cholesterol, or diabetes, the best thing you can do to prevent the risk of thrombosis with COVID-19 is to keep that condition under good control by taking your medicine, eating healthy foods, exercising, avoiding smoking, getting plenty of sleep and water, and keeping stress levels low. Medications which lower your cardiovascular risks to prevent heart attacks and strokes also seem to prevent COVID-19 complications, such as statins like Lipitor, ACE inhibitors like lisinopril, and anticoagulants such as aspirin and Plavix. N-acetylcysteine and vitamin C also help to decrease inflammation within blood vessels and prevent thrombosis. On the other hand, medications which increase your risk of heart attack and stroke, such as ibuprofen and other NSAIDs, also increase your risk of COVID-19 complications. So what can you do now? Social distancing and hand washing? Take zinc, vitamin C, vitamin D, and Claritin? Consider adding a daily baby aspirin and N-acetylcysteine. Take Tylenol for fever or body aches instead of ibuprofen. Maintain healthy habits. And talk to your doctor to identify any cardiovascular risk factors you may have and get them under control, and consider a statin for high cholesterol or an ACE inhibitor for high blood pressure. Thanks for listening. Have a good day.